And so glad, of course, that you came through well and on the other side. I can't imagine putting a child into a metal tube sealed at the neck. I didn't realize that. I don't know what I didn't realize it was like so tight around their neck, but thank you very much. Armand, I'm going to turn it over to you if you could introduce yourself as well as your guest this morning. Oops.
You're muted. You're muted, Armand.
I didn't realize I was muted.
There we go.
I don't know who did that to me, but Roger, thanks for all that. It certainly explains a lot. I'm glad you've recovered as fully as you have. To introduce myself, I'm Armand Reich. I'm a longtime member of this club and your friendly local neighborhood architect. So much for me. I have the distinct pleasure and honor of introducing Dr. Dilip Sarkar, who is a former vascular surgeon who had his own medical event and led him to retire and turn into a yoga guru, actually, who's world-renowned for yoga therapy and Ayurvedic yoga therapy, and he's written books and created videos. And without any further ado, Dr. Dilip Sarkar, thank you for being here.
He's also muted.
Dr. Sarkar, if you can unmute yourself.
Yeah.
Oh, there you go.
Here I go. Let me see. Here I am.
Good morning, doctor.
Okay, good morning.
Good morning and welcome.
Okay, good morning, Armand. You guys can all hear me. That's great.
Yes.
And good morning to all the members of Rotary Club of Cape Henry. I've been in this Hampton Roads for the last 45 years. I'm very close to Rotary Club. I have presented about health and wellness in multiple Rotary clubs in the past. So today I'm going to present a topic which is a part of health and wellness, which is your part of your humanitarian services that Rotary does. I'm sure for most of you it is entirely a new topic. So I decided not to do a formal presentation with the slides which I do for my healthcare providers. I want to show you a few things. You can sit down in a chair. And let me start with the title of the topic. What does it mean? It's a very important title for the present day, what is going on. I heard all about polio. What I got a message to do a spotlight for everybody. How do you do that? Okay. Gallery view.
I have you spotlighted, Dr. Sarkar.
Oh, you already spotlighted me?
Yes.
Okay, sorry. So I don't have to do, I just saw a message that, anyway, okay. So first of all, let me start with the term, which is called yoga therapy, and then it's for the COVID-19, and what is the relationship and what we do. Most of you know that yoga is a stretching, a twisting, and putting our body in some position for probably some comfort, relief. But with extensive practice, and we as a physician, we started finding it out, it is a lot more than that. It has a tremendous therapeutic effect. First of all, what you see as a yoga practice today for the whole country is just a small minuscule part of it, which is like your body poses. It is exactly the word itself, its meaning is called union. It unites your body, mind, and spirit. And primary outcome of this practice is called a relaxation response and called parasympathetic activation. What does the parasympathetic activation means? See, the stress is creating all of our lifestyle related disorders, diabetes, hypertension, heart disease, high cholesterol. You can name on and on and on, our low immunity, but it is primarily the activation of called sympathetic tone. It's called your fight or flight response. And the practice of yoga, which creates a parasympathetic tone, it counteracts the sympathetic tone, and primary effect is in your mind. It quiets down your mind. It's actually a philosophy, and philosophy has about 196 aphorisms, of which 193 is how to quiet down your mind. Practice is called the 8 limbs practice. It starts with they call a social restraint, personal restraint, poses, a voluntary regulated breathing, control of your senses, focus, meditation, and then finally called union of your body and mind. So in your present day metaphor, if you think a mind as a software and body is a hardware, you take care of the software, the hardware will get fixed. And our software has a lot of bugs. So a practice of yoga, which is essentially a daily practice, we say it is like a bug fixer. You have an iPhone, you get this iOS 14.1 updates, and the practice of yoga essentially updating your mind. It is also a daily routine. We maintain a daily routine, and I will go over with you a little bit in connection with the COVID-19. And also, it is your lifestyle. By the time you keep on doing it, you develop we call it a habit forming. The habit forming means a medical term. It's called neuroplasticity. Your brain gets a signal that I'm sitting here with my spine straight. I'm sitting in a stool. It's called a kneeling stool. And I do it all the time because I front of my computer. So I don't hunchback, I don't do this thing, which is very harmful for our physical body and mind. And my brain knows this is the way I need to sit, and brain allows me to sit down like this for a long, long time. So the relaxation response will come into play, and I will show you, even sitting in a chair. See, I'm a retired physician. I retired for a reason. Armand did not go through it. I've been practicing for the last over 40 years. But about 20 years back, I had a heart attack and have emergency open heart surgery. And I have absolutely no risk factors from our modern medicine. I have still my blood pressure is 120/80. I have normal blood sugar, normal cholesterol. I don't have this truncal obesity. But essentially what we started finding it out, it was essentially the high stress, the sympathetic overdrive. So today what we find out, the therapeutic potential of yoga as a therapy is the adaptation of these practices based on the patient's clinical condition. And it is being a part of our new branch of internal medicine, which is called integrative medicine. Integrative medicine basically is integration of the science of our modern medicine with the wisdom of traditional system of healing. It's not only yoga therapy. We have a lot of traditional system of healing, and of which has a very good outcome. Like American Indians. You may heard of shamanism. You may heard of called Ayurveda. What Armand was trying to say. Even the Chinese medicine is really a traditional system. So trying to integrate. 4 or 5 years back, about 15 years back, maybe about 4 or 5 medical schools had a department of integrative medicine. Today, almost 100 medical schools have a department of integrative medicine. They have a training program, board certification. So now, how does a COVID-19 connects with a yoga therapy? Now, first of all, if you look at the term COVID-19, so where it came from, I don't know, many of you know this, is called the COVID, CO stands for coronavirus. This is a very old virus. It mutated, became a new virus. It has a crown, if you look at the microscope. That was that name corona came from. VI stands for virus. D stands for disease. Like coronavirus disease is COVID-19 is, it was diagnosed in 2019. This is a hybrid virus, and we believe it came from your bat and a pangolin. And all the information we have in last 6 to 8 months, we are very convinced now that this is a respiratory virus. It comes through your breathing, it comes through your nose, and comes through your mouth. So let's go a step by step what COVID-19 does to our body and also our mind, and how yoga therapy can help and guide you and prevent, maybe do a little treatment for mild symptomatic or asymptomatic patient and help in a post-COVID setup. As you know, it primarily affects your lung. And then the sequence of events is, in the lung, it creates inflammation. The inflammation then spreads to your blood. It's called a septicemia. We develop a septic shock. Septic shock causes multiple organ failure. And if we cannot support the patient doesn't make it. But if you can support it, and there is no approved treatment today. If you look at all of these, the steroid, the dexamethasone, the antiviral, remdesivir, or also what a president got called a monoclonal antibody. These are all called compassionate use, that at the time of emergency, we can use it. So first of all, we as a yoga practitioners, we wake up in the morning between 5 to 6 in the morning. First, we try to sit down. And this is a gradual process. We learned it by years and years and years. Armand knows very well because Armand used to come to, in my class. Sit down, we drink a glass of water in a little bit of a room temperature. And that water really essentially helps having a proper elimination. It is called a gastrocolic reflex. So get a proper elimination in the morning, brush your teeth, and during yogic technique, we use what is called a tongue scraper. It's not the brush we use. And I have one, if you can see, this is called a tongue scraper. And this goes at the back of your tongue, and literally it scrapes, and you'll see all the gunk coming out from your tongue. So what does it mean? If the virus is coming through your mouth and your nose, some of the virus is going to stick to your tongue. So this is the first practice of a yoga therapy practice. Probably we are removing. We cannot give any scientific data yet. The data is being collected, but anecdotes and looking at that, it probably removes, a bulk of our viral load. So after tongue scraping, we do every single day. This is a part of our yogic routine. It's called the nasal washing. Nasal washing, it is called a neti pot. Many of you have heard it or never heard it before, but I will show it to you. What you do, we brush our teeth, we wash our face, wash our eyes, wash the whole, hair and everything, but why not our nose, nostril? Because this is the hair where all the breathing is coming. We say God made us from a clay and then finally gave us the breath to be alive. The breath is your life. So we use, again, I'm going to show it to you. If you have seen it before, it's fine. If not, it's like a pot. It's called a neti pot. And this pot is now, a long time back, we only used to get it from the health store. Now even Walmart sells it. So when Walmart sells it, it is, now entered into our American lifestyle. Target first started it. But what you do, we put a little lukewarm water. We put a little bit of a salt. We prefer and call a non-iodized salt. We put it through one nostril. And then initially it irritates a little bit and slowly goes away. Then close our eyes, breathe through our mouth, slowly turn one of our head. And it is a relaxation. When you relax, the water comes out through the other nostril. You blow your nostril and look at it. You said, oh my God, look at all the dirt I'm carrying in my nostril. You do in the opposite side. And after doing it, and it is being recommended in a lot of your integrative medicine that you do it when you have a flu, when you have a COVID-19. But for us, we do it daily as our lifestyle. So we think if there is some virus sitting here, it is going to essentially get flushed away. So now the virus is coming, but before also, you remember one thing, this is also called a novel COVID-19. Novel means new. We really don't know. We're calling it coming from China or coming from your pangolin or a bat, but it's creating first a tremendous amount of fear, panic, anxiety. Then we have another group of people who said nothing, they're sort of not even thinking about it. They're almost like a denial. And denial brings you sort of like a anger. Then it brings revenge. It brings acceptance. So all these things related to your mind. So a practice of yoga, which is relaxation response, and I'm sure I will take maybe 10 more minutes, about 8. How much time you have? 8:25 I can go? Or 8:20?
Yes.
Okay. I will show you a couple of things, so that you can take it home as a practice. So now the virus is entering into lungs. I don't know if you've heard about it. The way the virus works, the crown gets attached to the lung through an enzyme. It's an enzyme called ACE2, ACE, called angiotensin converting enzyme. And the interesting part is, most of us who have a cardiovascular disease, hypertension, heart disease, we are on 4 medications called aspirin, statin, beta blocker, and ACE inhibitor. So we are looking at the correlationship. Why the people with the heart disease are getting so much of COVID-19? Is there any connection of the ACE inhibitor with that? So the lung, it's created a tremendous amount of inflammation. And it is called a cytokine storm, the medical term. And the lungs is slowly filling up with a fluid. And then there is no gas exchange. The oxygen cannot come into blood and carbon dioxide cannot. You start becoming hypoxic, short of breath. And then the sequence, probably most of you know, we have put on first on the oxygen, then in a supportive, we call a CPAP, called continuous positive pressure. Finally, we have a ventilator, and the ventilator cannot support. You might hear a new term, it's called ECMO, ECMO, called extracorporeal membrane oxygenator. And we have a lot of patients came out from that. A primary practice of the relaxation response, activation of parasympathetic tone, also acts like anti-inflammatory. In fact, it also acts like an anti-thrombotic. Now we have found it out, you might have read in the paper that COVID-19 causes the blood clot. It is called a DIC, disseminated intravascular coagulation. And the most important thing is that the lung is like a balloon, and it has about 6-liter capacity. 1.5 liter is needed to keep the lung expanded. Then we have a 4.5 liter of gas which can exchange, which is called a vital capacity. So normally when I breathe in and out, I only breathe 500 cc, like a half a liter. So my lung has about 80 to 90% reserve. So now look at the COVID-19, what is happening. In yoga therapy practice, after we do the poses called asanas, then we do the voluntary regulated breathing. There's a big Sanskrit term, we call it pranayama. Prana is a life force, yam is a control. So how do you do it? What we do, we sit down, keep our spine straight, and essentially we go through a few steps. The first steps is that, so I'm going to show it to you, and if you want to do it, it's okay with me. If not, you can practice at your office or the setup. If you see our hand is connected to our mind. Remember, I see something good, I said this, or I want something, I said this. In fact, we have seen our hand gesture comes before you can even talk. So what we do, we said, you sit down with your spine straight. Here, I'm sitting in, it's called a kneeling stool. Then I touch my index finger and thumb, and I quiet down my hand. I do absolutely no movement of my hand. So I gently put my both the hands over my knees. Then what makes me very active, what makes me very restless is called 5 senses. What I see, what I hear, smell, taste, and touch, I close my eyes. The moment I close my eyes, and slowly a relaxation sets in. And it'll be amazing that when you first practice, and it happened to me too, I cannot even close my eyes. When I close my eyes, all this thought comes and I have to open my eyes. But slowly, it's not an issue. Then when you get relaxed, you can do a deep breathing. Remember, when you're scared, what happens? You have a very shallow, rapid breathing. Now you're relaxed. Now you have the whole lung full of carbon dioxide, which is 4.5 liters. And essentially what happens in the COVID-19 in the lung is very interesting phenomena, is that persons started to drop their oxygen level. I don't know if you've heard of it, it's called a pulse oximeter. We measure the oxygen, you put in your finger, we say how much oxygen you have. Normally it is 92% and up is good. Below 92, you get concerned. What I've seen, people with the COVID-19, they are not even symptomatic. Even their, as oxygen saturation drops even below 80, even sometimes 70. So we're very concerned. Sometimes someone said you had to give a term called a happy hypoxia. So in a lung, what we do first, in yoga practice and relax, my body is relaxed, my hands are closed, my eyes are closed. I breathe out. This is the first technique of a voluntary regulated breathing. Why? Because it's a balloon. Unless you empty the balloon, you cannot bring fresh oxygen in. Then we slowly breathe in and completely effortless. And whatever you can do, initially you'll be able to do 2 seconds, 3 seconds. We can do a lot longer. Then we breathe out longer than breathing in. If I get 2 seconds in, I'll go to 4 seconds out. And slowly we have seen it removes your carbon dioxide and improves your oxygenation in the blood. So last few minutes, let me just show you the practice of the breathing, which is helpful for the COVID-19. And there is a lot of other practices. When you come, we can go step by step, but this is because COVID is affecting your lungs. So here, let me show you in couple of minutes what I'm going to do and how to do the breathing. Again, I'm keeping my spine straight. And remember the reason for the spine straight. So my skeleton is always going to fall in the front. So I have the muscles, it's called the muscles in my back, called paraspinal muscles. which is tight, keeping me straight. So by able to keep myself straight, I'm giving a tremendous relaxation to my body and mind. I control my hand, close my eyes. First, I'm breathing out. First, I'll breathe out. Count of 2 in, 1 and 2 in, and count of 4 out. 1 and 2 and a 3 and a 4, completely effortlessly. So I'm breathing out first. I'm breathing in, count of 2 in. Breathing out, count of 4 out. And I keep on doing it. And slowly, you don't have to, you keep on doing it where you feel comfortable. But for us, we've been doing it for so long. Let me just show you, give an example so you'll understand why the breathing is so important for COVID-19. Here, I'll be able to do, say, 5 seconds in and 10 seconds out, which will be almost difficult for most of you to start with. So here I am. I'm breathing out first. 5 seconds in, 10 seconds out. Very easy for me. So think about the amount of carbon dioxide coming out and oxygen coming in. So also what happened, the poses you see, which is called asanas, poses, will be holding the poses. Like I want to do a spinal twist. I'm in a sitting chair, I do a little bit of a twist, and I stay in the posture. I stay in the posture again, breathing out longer than breathing in. So slowly what happens, the effect of the physical posture creates a relaxation of the physical body. It allows you to do a voluntary regulated breathing, exhalation longer than inhalation, removing all the dirty carbon dioxide in your lung, bringing fresh oxygen, and helping all of us. In fact, this breathing technique helps us is the physical marker of our health. And also, let me finish with my final statement is that the breath is the connector between body and mind. If you're able to control your breath, mind quiets down. Example being, when my mind is under stress, mind is hyperactive, what happens to me? I do rapid shallow breathing. But see, guess what? I see something, a beautiful picture. What I said, breathtaking. What is breathtaking? When the mind quiets down, breathtaking. I think I'm looking at my clock. I'm coming to the closing of your time.
Keep going.
I will be keep coming to you and show some beautiful practices. Armand knows. And if you tell me to keep continuing, five more minutes.
No.
Yes,
continue.
please.
Okay. So now it comes the say practice.
No.
So what are the practices? Practices is we learned from the babies. If you say baby will do every posture, they call it yoga posture. So in a hand, if you look at a baby will close their hand. I don't know, we are all grandparents now, we have seen all of our grandkids. Baby will close their hand by putting a thumb inside and close. This is called a baby fist. Why? Baby is entirely relaxed. If you see a baby is totally relaxed, baby's mind is clear. When baby breathes, it's called a very nice, called abdominal relaxing breathing. So throughout the whole day, we close our fist like this. So practice it. If you can put your thumb in, initially thumb will be here, but slowly for us. And we can guarantee your hand will get relaxed. When hand gets relaxed, initially, when the hand is tight, nothing goes through. When the hand is relaxed, you can go to very easily. So this is the practice we do 24/7. If you can practice with me. Also, we do the breathing, like when you breathe in, breathe out. I do it with my eyes closed. When the hand gets relaxed, it's amazing. You know, all the pains and aches we have, you know, called arthritis pain, it is not the inflammation which is causing it. It's called tightness. It's called splinting. Pain goes away. So now if you come to your shoulder, so if you come to your shoulder, if you can sit down and put your hand shoulder, and slowly if you can rotate your shoulder. And we need to rotate with the eyes closed with the breathing. Breathe in and breathe out. So I even do this thing even sitting in my, as I said, I'm wearing a suit. I'm at home, but this is my normal outfit when I go and practice. So I'm in the same outfit, I can do it. So I'm not, see, you know, I'm not changing my daily routine. Even in this last 8 months of COVID-19, I've been, you know, we are so lucky that we're connected. Thanks, Armand, because I'm busy every single day. I'm presenting now online. They know I'm home. I'm presenting all over the world. Most importantly, neck. Neck gets tightened up. So let me show you how to relax your neck. The moment you relax your neck and shoulder, your breathing becomes effortless. Here I'm straight. My spine is straight. Again, put the hands. Might be put a hands like this, called a baby fist. Powerful relaxing force. Close your eyes. Then slowly you breathe in, put your neck in the back, and breathe out. Slowly drop your neck in the front. And what you're looking for a sign of pain. If you get any pain, you back off. Do not go up to the level of your pain, because pain basically in yoga says, pain means pay attention. You know, Western medical term said no pain, no gain, but yoga said no. Pain is, you have to respect your pain. So if I get a pain here, I get short of pain, but I stay here. What happened, I'm staying, my relaxation sets in and slowly comes down. But I do it with my breathing. Breathe in, breathe out. Keep doing it, and you are not competing with anybody. You are only competing what you can do. Second will be, you know, there are 4 stages, but let me show you a couple of stages so you'll be able to do it at your office. And it is a wonderful relaxation practice. Breathe out first. Always breathe out in yogic practice because you have to empty your lungs. Take a deep breath in and slowly turn your neck all the way to the back without turning your shoulders. And the same breathing cycle, slowly bring your neck in the front. So what you're doing, you're extending your exhalation. And exhalation is parasympathetic, inhalation is sympathetic. Exhalation relaxes you. So again, you breathe out first. Take a deep breath in. Look at the opposite side. But with your breathing, don't hold your breath, don't do anything. It will be completely effortless breathing. And a lot of people ask me, what does effortless breathing mean? Effortless breathing means you will be able to talk, you will be able to sing, you will be able to breathe completely effortlessly when you are doing this. Finally, you slowly rotate your neck from the left to the back to the right, then right to the back to the left. So drop your head down, you breathe out first, take a deep breath in, slowly turn your neck to the left, then to the back, slowly to your right, and in the front. You keep on doing it, do it about a few times, 5 times, 10 times when you have the time, even your desk. Again, on the opposite side, breathe out first, take a deep breath in. Now, turn it on the right side, back, left, and in the front. When you keep on doing it, you will feel a profound level of relaxation. So let me finish with my final statement is, a lot of people ask me and say, I'm exercising, I'm treadmilling, I'm weight training. Why do I need to do this relaxation response? I do it too. I do a treadmill, I do a weight training, I do every other day, I do Monday, Wednesday, Friday. But every morning, I do my yogic lifestyle, I do relaxation response. Why? Exercise is primarily a sympathetic overdrive. What is sympathetic overdrive? My heart rate goes up, my pulse rate goes up, my blood pressure goes up, my respiratory rate goes up, but my body then starts creating called the homeostasis. Homeostasis calls the default mode. That means body needs to bring me back in the default. It creates a parasympathetic activation. So exercise does not increase your heart rate pulse rate comes down. You see, what is your resting pulse rate? So exercise is a sympathetic overdrive followed by parasympathetic activation. But yoga practice is a primary parasympathetic activation. When you get a sympathetic overdrive, you do have some crisis and catastrophe. Like I'm running without protecting my breathing, the body. At the end of the running, somebody have a heart attack, somebody might drop dead. You do weight training. With the weight training, you do 300 pounds, 200 pounds. That is your hurting most. What you need to do is find a way by which you close your eyes and say, and eventually you'll see slowly increase your weight and become, that's why I train the athletes. Thank you again for your time. I took so much of your time. I'm very particular in time. I'm a surgeon, so thank you for giving me a few extra minutes. I'll be able to ask any questions if you have.
No, we're
have an extra time. I'm here with all of you.
we're really out of time for the meeting. Although you're more than welcome to stay on a little bit later after we close. David, could you finish up for us?
Yeah, Doctor, we have, next time you come in person in a meeting, we have a little commemorative mug we'd like to give you.
Thank you, sir. I'll take it. This is the honor, and I have, again, answering that, I have collected mugs after mugs after mugs. I have a whole house full of mugs.
Excellent.
Everywhere I go, get a mug. That's good. But I know that's my collection. So.
Yes.
Thank you very much.
Okay.
Welcome, sir. Welcome, sir.
I'm for a yard sale, doctor.
Okay.
Thank you. Anytime. Or if you have any question, I think Mr. Johnson and Armand has my contact. You
Yes.
text me or shoot me an email. I'll be glad to answer. And Armand can find me. He can always find me, and he can.
Yes.
And all my informations are in the cloud these days. We are all in the cloud, so you can find me
Okay.
and ask me. And any health question, I'll be glad to answer. This is my community service. And as I said, the community gave me enough. This is my time to give back. I'll give it back to you.
Okay. Thank you very much.
Good, doctor.
Welcome. Welcome.
All righty.
Really appreciate you coming.
Thank you, Armand.
Thank you.
Very much.
Yeah, I enjoy this thing because I'm not teaching, I'm not doing anything. You know what I'm doing? I'm sharing my daily practice, and I've already done this practice, and I'm just sharing with you. And I love to share with you now when I'm all dressed up and share with you. I love this. This is the way incorporate in your lifestyle.
Yes, it is.
Okay.
Thank you.
Okay. Thank you.
Thanks, doctor. I need to go. Oh, the four-way test, yes.
Yes.
I'll lead.
Okay.
Of all the things we think, say, or
saying
do,
you.
Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial?
Beneficial.
all concerned.
done. Thanks, y'all. Thanks for coming.
Thank you all. Have a great day.
Have a great week.
Be in touch soon.